Medullary sponge kidney, also known as Cacchi-Ricci disease, is a congenital disease where the medullary part of the kidney, which is deeper inside the kidney, gets loaded with fluid-filled cysts, which gives the kidney the appearance of a sponge. Now, the kidney can be divided into the cortex, which is the outer layer, and the medulla, which is the layer below that. Kidneys have millions of tiny nephrons, which filter the blood, each of which is like a little tube that receives blood on one end in the cortex. From there, the nephron dips into the medulla, and then goes back out into the cortex, and finally dips back into the medulla a second time to connect to the collecting ducts, which gather up all the urine. Not every nephron has this exact structure, but a lot of them do. From there, the urine drains through the papilla, which is an inverted cone-shaped pyramid that, like a showerhead, pours urine into the calyces, which comes from the Latin calyx, which means large cup, kind of like a fancy Roman chalice. From there, it enters the renal pelvis, which funnels the urine into the ureter, then to the bladder, and then finally leaves the body out the urethra. Now, medullary sponge kidney has to do with the development of the kidney. So, during fetal development, first off, you've got this structure called the mesonephric duct, which is involved in development of urinary and reproductive organs. And during the 5th week of gestation, a little guy called the ureteric bud starts pushing its way into another structure called the metanephric blastema. And together, these two little embryologic structures go on to develop into a kidney. At about the 7th week, nephrogenesis, or formation of the kidneys, starts under the influence of that ureteric bud. By about 20 weeks, the ureteric bud has formed the ureters, the renal calyces, collecting ducts, and collecting tubules, while the metanephric blastema develops into the nephron itself, which includes the epithelial cells and the podocytes of the Bowman's capsule. In the 3rd trimester and throughout infancy, the kidneys continue to grow and mature. Although not completely known, it's thought that medullary sponge kidney is a result of some sort of abnormal induction of the metanephric blastema by the ureteric bud. This failure might be the fault of the mesonephric duct not forming right, or the ureteric bud not forming right, or both. Whatever the case, in medullary sponge kidney, the hallmark features are dilated collecting ducts, meaning enlarged, as well as small cysts that form around the collecting ducts. Even though medullary sponge kidney is present at birth, sometimes complications don't pop up until adulthood, and even then they might come and go. The most common one is nephrolithiasis, or developing kidney stones, which are made of calcium phosphate or calcium oxalate. These form in the collecting ducts and surrounding tissue, and these result mostly from a failure of the kidney cells to properly reabsorb or secrete solutes, which ultimately results in stone formation. For example, there might be high levels of calcium, phosphate, and oxalate in the urine, all of which are not very soluble. In addition, there might be low levels of substances like citrate in the urine, which would normally increase their solubility. Making matters even worse, medullary sponge kidney can lead to metabolic acidosis, which can cause calcium to leach out of the bones, which raises the amount of calcium that gets filtered through the kidneys. Together, the kidney stones and cysts obstruct urine flow, creating pockets of stagnant urine. Those stagnant pools of urine allow more time for solutes to precipitate and crystallize into stones, which creates this vicious cycle of stone formation. Ultimately, a kidney that's full of cysts and stones with areas of stagnant urine also invites bacteria to flourish, resulting in urinary tract infections. So, the symptoms of medullary sponge kidney are related to these complications. Kidney stones tend to cause bouts of extreme pain and blood in the urine from tissue damage, and urinary tract infections can cause fevers as well as pain. Medullary sponge kidney is usually diagnosed by medical imaging. For example, an intravenous pyelogram is a type of X-ray that uses contrast to show the enlargement and hyperdensity of the collecting ducts and cysts. These tend to show a classic feathered appearance of the ducts at the interface of the papilla and calyx. Treatment of medullary sponge kidney might target preventing stones from forming, which includes keeping an individual well hydrated, taking citrate supplements to make calcium more soluble, and taking bicarbonate supplements to prevent calcium from getting leached out of the bones. If small stones develop, they can be broken down with focused shock waves, or surgically removed before they get bigger. Finally, complications like urinary tract infections can be managed with antibiotics. Alright, as a quick recap. Medullary sponge kidney is a congenital disorder where the medulla is full of large collecting ducts as well as cysts. To make matters worse, the nephrons can become dysfunctional, which allows high levels of calcium, phosphate, and oxalate in the urine, which can precipitate out and form kidney stones. Together, these cysts and stones can predispose an individual to getting infections. How's it going, guys? Hope you liked that video. It was written by Amanda and edited by Rishi and then illustrated by myself. Don't have much else for you besides to remind you to check out our subreddit called r/osmosit. It's pretty new and needs some subscribers. So go there and check out some of the videos and post some comments, classic subreddit things. Otherwise, you can always subscribe to our YouTube channel, donate to us on Patreon, as well as follow us on social media. All right, guys. See you later.